My name is Mariah Shields, and this is my colleague Mandy Anderson. We both work at ARIN IU on the training and consultation team, which serves Armstrong and Indiana County schools. Mandy and I are both certified instructors in youth mental health first aid and teen mental health first aid. Today, we'd like to talk with you about youth mental health in our community. In recent news, nationally, regionally, and locally, there has been a rise in reports of school-based threats. We wanted to reach out to our local schools and community to bring awareness to school safety and mental health, as well as talk about the resources and trainings available to assist our teachers, staff, and students and the community. The Pennsylvania Youth Survey, or PAYS, is sponsored and conducted every 2 years by the Pennsylvania Commission on Crime and Delinquency. The data gathered in PAYS serves two primary needs. First, the results provide school administrators, state agency directors, legislators, and others with critical information concerning the changes in patterns of the use and abuse of these harmful substances and behaviors. Second, the survey assesses risk factors that are related to these behaviors and the protective factors that help guard against them. This information allows community leaders to direct prevention resources to areas where they are likely to have the greatest impact. The first graph we're going to look at depicts how students in Indiana County answered yes to there being a positive school environment. As you can see, students feel they have the opportunity to talk one-on-one with teachers, participate in class discussion, and feel safe in their school. Scores are reflected lower on the praising for working hard in school. Many of our local districts are implementing positive behavior interventions and supports with the integration of MTSS, which will help to support growth in this area. Here we're looking at the positive school environment for Armstrong County. The data is very similarly represented, and our districts in Armstrong County are also training and implementing PBIS and MTSS initiatives to help improve these areas over the next couple years.
This graph shows how Indiana County students perceive the importance of school later in life and how meaningful and important their schoolwork is to their future. Indiana County is running slightly above the state average. Armstrong County is showing similar results, but slightly lower than the state average.
The PAYS survey also looks at the risk and protective factors associated with each county. The protective factors increase resilience and help to support our youth with stressful situations. The graph depicts the protective factors and how students in Indiana County feel about the opportunities and rewards for pro-social involvement in their school, family, peers, and community. Here we have the protective factors in place in Armstrong County as well.
Next, we're going to look at the risk factors in our schools and communities. Risk factors are predictive of a youth's likelihood to engage in problem behavior. Let's take a look at how risk factors are impacting Indiana and Armstrong counties. For this question, youth were asked about their ability to access these dangerous objects and substances. Youth access to these dangerous substances and objects is an area of concern for both Indiana and Armstrong counties.
This graph shows the percentage of students in Indiana County who reported having a mental health concern one or more times. I'd like to emphasize that we are lower than the state average in many areas for mental health concerns in Indiana County, and the new category this year shows that in the past month, students felt their overall mental health was good. Armstrong County mental health concerns run similarly with the state average, but they are also showing a strong percentage of students reporting their mental health is good. I'm sure our audience is wondering, how can they help? Mandy, can you share some of the ways that we can help our youth in our community?
Absolutely. If you'd like to learn more about these ideas, you can scan the QR code on your screen to bring up an article from Edutopia. These are some quick, easy things that you can incorporate into your day, like breathing and meditation techniques. Not only will it benefit you, but you can teach your students these self-care techniques. Also, make sure you're communicating with your administrators that you need support. Schools have lots of resources to offer, but if they don't know that there's a problem, they can't give you the resources you need. Also, make sure you get outside. As a teacher, it's so easy to spend your entire day indoors looking at a whiteboard and a screen. Block time out before or after school, whether it's sitting quietly with a book or exercising in the park. And you can establish peer support programs. Train a handful of teachers, if not all of them, to be leaders in the school's mental health movement. Form support groups that can openly discuss mental health and challenges specific to the education system. This is a great opportunity to become certified in mental health first aid.
Absolutely.
As mentioned earlier, Mariah and I offer 2 forms of mental health first aid training at ARIN IU 28, Youth Mental Health First Aid and Teen Mental Health First Aid. The PACE data we've looked at today matches the national statistic that 1 in 5 teens in the United States will experience a mental health challenge. And some of our youth in Indiana and Armstrong counties are experiencing these challenges right now. At ARIN IU, we offer youth mental health first aid training to school teachers, staff, coaches, and community members. Youth mental health first aid teaches adults how to identify, understand, and respond to signs of mental health and substance use challenges among children and adolescents ages 12 to 18. As shown in the previous slides, youth in both Indiana and Armstrong counties are reporting to have easy access to substances and weapons. We teach a 5-step action plan on how to help students in both crisis and non-crisis situations.
With the support of the United Way of Indiana County, Indiana Area School Districts, and ARIN Intermediate Unit, we secured a grant from Armstrong Indiana Behavioral and Developmental Health Program to support the implementation of youth mental health first aid with our teachers and teen mental health first aid with our students. As you can see on the slide, over the past year, we have trained 195 teachers and staff in youth mental health first aid to assist the students in their schools. Teen Mental Health First Aid Training is a program for teens that teaches teens in grades 9 through 12th grade how to identify, understand, and respond to signs of mental health and substance use challenges in their friends and peers. The program gives teens the skills to have supportive conversations with their friends and how to get help from a responsible adult. We all know they're going to talk to each other before they might talk to an adult. In the past year, we've trained 678 students through this grant. Mandy and I, along with trainers within each of the 6 school districts listed there, have worked with students in 10th grade on this 5-step action plan to assist their peers in need of mental health supports.
For additional information and mental health resources, you can scan the QR code or visit the tiny URL ARIN MHFA. If you're interested in becoming a youth mental health first aider, we offer trainings at ARIN IU annually, or we can bring the training to your organization. Thank you for visiting our video, and we hope to hear from you soon about how you can help your school and your community. Our contact information is listed here. Reach out anytime.